Hello everyone, welcome back to my YouTube channel, The Exploring Medicò. So today I am back with another part of the pharmacology. In the last session we have discussed the fields of pharmacology, sources of drugs and everything. In today's video we are going to discuss about drug nomenclature and all. So kindly watch the entire series because it will be beneficial for you, whether it is medical, paramedical students. They can watch this video, they can gain the knowledge from this video. And if it is any BHMS, BIMS student who are having their own pharmacology subject, then they can watch this modern pharmacology, because if they are want to practice in the future as an allied subject, then this will be more beneficial to you. So let's start the next part, that is general pharmacological principles, drug nomenclature. A drug generally has three categories of names. So drug nomenclature is divided into three categories. First is chemical name. It describes the substance chemically. A chemical name itself says it describes the substance chemically. For example, 1-isopropyl amino 3,1-naphthyloxy propane-2-ol for propanol. Now this is cumbersome because this name is so long and not suitable for use of prescribing. Means if anyone wants to prescribe this drug, then this name is so long and it won't be used in the practical purpose because no one is going to remember this one long name of drugs. And even it will be harder for chemist to see this chemical name and give the drug. So code name RO151788, later named flumazenil. So this drug was later named flumazenil, may be assigned by the manufacturer for convenience and simplicity before an approved name is coined. So before approving a name, they use such type of code to classify the drug, which is easier. Now next is non-proprietary name. It is the name assented by a competent scientific body or a authority. For example, the United States adopted name USAN by the USAN Council. Similarly, there is a British approved name ban for a drug. The non-proprietary names newer drugs are kept uniform by an agreement to use the recommended international non-proprietary name RINN, international non-proprietary name, in all member countries of the WHO. So non-proprietary name is given by different council, but now it is uniform by RINN. The British approved name of older drugs as well as now have been modified to commensurate with RINN. Commensurate with RIN means now they had merged with the RINN. As per the rules of RINN, the banned types of drugs which were old or which were new are now being modified according to this. However, many older drugs still have no more than one non-proprietary name. Example, methadone and pethidine, lidocaine or lignocaine for the same drugs. So these drugs are same, but still they have more than two non-proprietary names. Until the drug is included in a pharmacopoeia means legally giving the name to the drugs. It is a procedure where a drug is scientifically accepted with all the things. You will learn in this session only over there. The non-proprietary name may also be called the approved name. So this name is approved name. We have seen in the chemical name that until the approved name is not given, they use that type of code. Now approved name means for non-proprietary name given to a drug, like this lidocaine, lignocaine, this. After its appearance in the official publication, it becomes the official name. In common parlance, the term generic name is used in place of non-proprietary name. So nowadays generic name are used, but etymologically this is incorrect because generic should be applied to a chemical or a pharmacological group of the compound. For example, phenothiazines tricyclic antidepressants, aminoglycoside antibiotics. However, this misnomer is widely accepted and used in even official parlance. So they wanted to convey through this that after official name, they are generally used as generic name in place of non-proprietary name, but it is not useful because this generic name is more helpful to the pharmacological group. But still, this is as it is. Generic name is also used more than non-proprietary name, and it is widely accepted. Now next, proprietary name, that is brand name. It is the name assigned by the manufacturers and his property or a trademark. It is a brand name, like any different brand, Shipala, different drugs brands are there. So it is the trademark given to a drug. If anyone is selling the drug, they give it their own trademark. One drug may have multiple proprietary names. For example, Mcard, Amlogard, Amlocor, Amlong, Amlopine, Amlovas, Stamploforan, amlodipine from a different manufacturers, and different manufacturers give different names to the same drug according to their brand. Brand names are designed to be catchy, short and easy to remember. Do remember this thing, they should be catchy, short and easy to remember, and often suggestive. For example, Lopressor, suggesting a drug for lowering blood pressure. Brand names generally differ in different countries. For example, Timolol myelate eye drops are marketed as Timoptic in USA and Glucomol in India. So it is not necessary that the same brand name is given to all drugs. Different same drugs have different name in different country origin. Even the same manufacturer may market the same drug under different brand names in different countries. So if it is Glucomol in India, same it is Timoptic in US. So it is not necessary that Glucomol is in India, then throughout the world that drug will be sold by the manufacturer with the same name. Same manufacturer gives the different names as per the country. In addition, combined formulations have their own multiplied brand names. This is responsible for much confusion in drug nomenclature. Now, there are many arguments for using the non-proprietary name in prescribing uniformly convenience and economy better comprehension. For example, propanol, sotalol, timolol, pindolol, metropol, acebutolol, ethanol are all beta blockers, but the brand names have no such similarity. Means even some are such brand name that are not generally used as an approved name. Like these all are beta blockers, but the brand names have no such similarity. You cannot say that entelol and timolol is same, because timolol is even used for the in a different country. Like this name is used for the timpolol as an eye drops. Now if you see timolol and ethanol, then you might get confused that whether they are both same or not. So some kind of brand names are such that their medicine and drugs is same, but the name confuses you. Drugs marketed under non-proprietary name called generic products are much cheaper than their branded counterparts, partially because the manufacturer invests a lot of money in promoting the brand name, and usually the medicines are sold as per the brand name only. Like Cipla is a good and famous brand name, then they have such kind of taxes, and even the doctors have reunion with the pharmaceutical companies. So generally the medicine is sold based on brand name more than the convenient effect of the drug. Drug effect is seen later on. First it is seen that it possesses to which brand, it possesses to which proprietary name. However, when a drug is prescribed by the generic name, the chemist is free to dispense the generic product from any manufacturer. Means if generic name is non-proprietary name, then chemist can easily give it to anyone, but not so when the drug is prescribed by a brand name. Because if someone says that I want the medicine from Cipla, then the chemist or druggist have to provide the medicine of Cipla company. But if someone goes and says that give me the drug for a fever, then he is free to prescribe any drug, because no one has told the specific brand name, only they have used the generic name that for fever I want, then the chemist can give any. But if you specifically say that I want the drug of this brand, then the chemist have to give you. Getting? Thus, when it is important to ensure consistency of the product in terms of equality and bioavailability, and especially when official control over quality of manufactured products is not rigorous, it is better to prescribe by the dependable brand. Means if manufacturer product is not done carefully, the manufacturing of the product is not done carefully, you don't know about that generic name, then it is better you depend on the brand and prescribe the medicine, because if you know that this brand is giving a good medicine, then it is better you prescribe with that rather than giving with a generic name. Now next topic is drug compendia. Compendia means what? Collection of a concise but a detailed information. It is short and sweet. These are no such type. These are compilations of information on drugs in the form of monographs. It is a variety of information on drugs in the form of monograph without going into the theoretical concept, mechanism of action and other aspects which help in understanding the subject. Now, pharmacopoeias and formularies are brought out by the government in a country, hold a legal status and are called official compendia. So these both are official compendia which have a concise but in a detailed form regarding drugs. There is pharmacopoeias and formularies. Pharmacopoeia we have seen earlier, no? In addition, some non-official compendia are published by professional bodies which are supplementary and dependable sources of information about drugs. So other than these are non-official, which are supplementary means extra, they published by their own companies, published by their own brand name. But it is not officially. Generally the seller and buyer have to decide about it. But the two official compendia are pharmacopoeias and formularies. Now pharmacopoeias, they contain description of chemical structure, molecular weight, physical and chemical characteristics, solubility, identification, assay method, standard of purity, storage condition and dosage form of officially approved drugs in a country. So drugs which are officially approved, this all details regarding drugs are given in pharmacopoeias. And they are useful to drug manufacturer and regulatory authorities but not to the doctor, most of whom never see a pharmacopoeia. But these all things that the solubility of this drug is when, storage condition is when, standard of purity is when, these all things are not much useful for doctors because dosage and these all things are practically which they learn, but the doctor don't learn chemical structure of it, molecular weight, in which condition they have to store. These all are things which is more useful for pharmacist rather than a doctor. For examples, in India it is IP, in British it is BP, in Europe it is EURP, and in United States it is USP, pharmacopoeias. These are different pharmacopoeias of different countries. Now, formularies. Generally produced in a easily carried booklet form, they list indications, dose, dosage form, contraindications. Indications means in the condition you prescribe the drug, and contra indications means when this treatment should be avoided in special medical condition, when you should not give this drug. So formulary says both when to give, when to not to give. Precautions, adverse effects and storage of selected drugs that are available for medicinal use in country. Drugs are categorized by their therapeutic class. Some rational fixed dose drugs combinations are included. Rational means what? All these drug combinations which are sold in the market, they are generally dependent on the formularies and everything. So rational fixed dose is given. Getting it? That is logical. We can say that it is a logical drug. Means drug combination is given in a logical manner, that why the amount of this or this substance is added in this drug, and they have mentioned the reason for it, that adding these things leads to this. A brief commentary on the drug class and clinical conditions in which they are used generally precedes specific of individual drugs. I told now this is what rational fixed drug. So when you can use it. Brief guidelines for treatment of selected conditions are provided, while British National Formulary (BNF) also lists brand names with cost. In British National Formulary, they even give the brand name in the formularies, but in National Formulary of India, NFI does not include this. So in India, we don't have this. Most formularies have information appendices as well. Formularies can be considered helpful to prescribers. So this is helpful for doctors. Formularies. Martindale, the complete drug reference, that is extra pharmacopoeia, published every 2 to 3 years by the Royal Pharmaceutical Society of Great Britain. This is non-official compendium. Is an executive and updated compilations of unbiased information on a medicinal use. So this is unofficial compendium, Martindale, which gives the all these informations regarding drugs registered all over the world. It includes new launches, contains pharmaceutical, pharmacological as well as therapeutic information on drug, which can serve as a reliable reference book because it has all these informations. Physician's Desk Reference (PDR) and Drug Facts and Comparison, both from US etc. are other useful non-official compendia. Now, essential medicine, that is drugs. Now, WHO has defined essential medicine or drugs as those that satisfy the priority healthcare needs of the population, which is helpful for the better health condition, which is in the benefit of the citizen. That is the side of the essential medicine. They are selected with due regard to public health relevance, evidence on the efficacy and safety, means the result we want. They describe it, and comparative cost effectiveness. Essential medicines are intended to be available with the context of functioning health system at all times and in adequate amount, in appropriate dosage form, with assured quality and adequate information at a best price of the individual and community can afford. So essential medicine should be such which is available in the adequate amount in appropriate dosage form, and it is affordable by every citizen. It has been realized that only a handful of medicine out of the multitude available can meet the people care needs of majority of people in any country. Means we need the more amount of drugs to provide to each healthcare, and that many well tested and cheaper medicines are equally or efficacious the same as the newer, more expensive congeners. So if you give more, means some types of drugs are same but more expensive. Expensive congeners means even you have the same drug, but many are cheaper and many sell the same drug in a very cost amount. Getting it? For optimum utilization of resources, governments, especially in developing countries, should concentrate on this medicine by identifying them as essential medicines. The WHO led grant to selection of essential medicine. Now, how the essential medicine should be selected? These all are the criteria defined by WHO. First is adequate data on efficacy and safety should be available from clinical studies. Means the result you want, result you desired, and the safety of the drug. First, that should be studied. It should be available in a form in which quality, including bioavailability and stability on storage, can be assured. So the stability of the drug, manufacture of the drug, and the bioavailability means in the how much period they are manufactured. This should be learned. Its choice should depend upon pattern of prevalent disease. Pattern of prevalent disease means coming for the disease. Availability of facilities and trained personnel, financial resources, generic, demographic and environmental factors. Demographic means regarding the population, economically population. In case of two or more similar medicines, choice should be made on the basis of the relative efficacy, safety and quality, price and availability. When two drugs does the same functioning, then first see the relative efficacy, means the result you want is in which drug it is better result. In safety of the drug, quality, price. Although the result is same in both, the if any such drug which has lesser price, then you can prescribe that also if the efficacy is same. And availability, whether this drug is easily available or not. Cost benefit ratio should be also major consideration. Choice may also be influenced by comparative pharmacokinetic properties, means what drug does to the body. You should this keep in the mind. You learn pharmacokinetic properties, means if you prescribe the drug, be sure what will be the side effects, what does the drug have the functioning on the body, and local facilities for manufacture and storage. Most essential medicine should be a single compounds. Fixed ratio combination product should be included only when doses of each ingredient meets the requirement of a defined population group. Means only you should give such type of essential medicine, only you should name the essential medicine when it is fulfilling the requirement of populated community too, and when the combination has proven advantage in a therapeutic effect, safety in adherence, decreasing the emergence of drug resistance. Selection of essential medicine should be continuous process which should take into account the changing priorities for public health action. Means as per the new symptom and as per the new conditions, the essential medicine should be kept updated. And epidemiologically conditions as well as ability of better medicines formulations and progress in pharmacological knowledge. Means epidemiological is a branch of medicine which generally deals with the distribution and control of disease. So these things also should be discussed. Recently it has been emphasized to select essential medicine based on rationally developed treatment guidelines. That is logical treatment guidelines. Rationally means logical. To guide the member countries, the WHO brought the first model list of essential drugs along with the dosage, form and strength in 1977, which could be adopted after suitable modifications according to local needs. This has been revised from time to time and the current is in the 20th list, that is in the 2017, which has 433 medicines including 25 fixed dose drug combinations, that is FDC. India produced this National Essential Drug List in 1996 and has revised in 2011, and now in 2015 with the title National List of Essential Medicine. The latest is include 376 medicines, of which 20 are FDC, that is fixed dose drug combinations. These medicines have been marketed into three categories for being people primary, secondary and tertiary levels of healthcare facilities, means where the requirement of drug is how much. Dependent on this, they have classified. Adoption of this essential drugs list for procurement and supply of medicines, means how obtaining of drugs and supply of medicines, especially in public healthcare system, has been resulted improvability in medicines, cost saving and more rationalization of drugs. Now prescription and non-prescription drugs. Let's see the difference between this. As per drug rules, majority of drugs, including all antibiotics, must be sold in retail only against a prescription issued to a patient by a registered medical practitioner. Means if anyone wants the antibiotics, then it should be prescribed by any doctor. Never give a medicine directly to a person. These are called prescription drugs, so which are prescribed by a registered medical practitioner. And in India, they have been placed in the Schedule H of the Drugs and Cosmetic Rules 1945 as amended from time to time. So the prescription drug is Schedule H. However, few drugs like simple analgesics, paracetamol, aspirin, antacids, antacid means omeprazole, labenzole, laxatives like senna, lactulose, vitamins, ferrous etc. are considered relatively harmless and can be produced without the prescription. So thus this type of drug can be even given by a without prescription, and these are known as non-prescription or over-the-counter drugs, OTC drugs, and can be sold by a grocery stores. So these are the normal drugs which are essential in life and day-to-day life with the small disease conditions, and they don't need prescription. So these non-prescription drugs are also called over-the-counter drugs, OTC. Now orphan drugs. These are drugs or biologically products of diagnosis, treatment, prevention of a rare disease or a condition. Means which is not populated within the populated country. You cannot see the disease easily, but it is a rare or more common disease endemic only in a resource poor countries or area for which there is no reasonable expectation that the cost of developing and marketing it will be recovered from the sales of the drug. So these are the biological product which is given based on the diagnosis, treatment and prevention of a rare disease. And for orphan drugs, generally the permission from the government is needed. As per Orphan Drug Amendment in 1983 Act of USA, a rare disease or a condition is one that affects less than 0.2 million people in the USA. So if any disease condition is like that, then it is called rare disease according to ODA, that is Orphan Drug Amendment. Though these drugs may be life-saving for some patients, they are commercially difficult to obtain as a medicinal product. Government is in developed countries offer tax benefits and other incentives to pharmaceutical companies for developing and marketing orphan drugs. And even they provide their benefits to the pharmaceutical companies. Orphan drug status must be awarded to many drugs in the USA, Europe, and some other countries. Few examples of drug granted orphan drugs are listed in the box given above. So these all are the orphan drugs which is official, like azithromycin, bevacizumab, bortezomib, busulfan, carboprost, clofazimine, etc. You can read it. Okay. So these all are the orphan drugs which is officially given the name and sell as per the permission of the government. So today's topic was till here. Do like the content, share the video, and today's topic is quite easy because it is just you to remember the small things. And we will be back with the next video of this series soon. So please watch the entire series and gain the knowledge. Share with your friends. Okay. In case of any doubt, you can ask in the comment section. Thank you. Have a good day.